Hi, this is Joey from the Clinical Nurse Education team to show you how to remove a PICC line in about 2 minutes. So, first and foremost, verify the order to DC the PICC line. Next, you're going to look for the documentation of the original insertion. Identifying the length of the catheter is very important when removing it to ensure we remove the entire catheter. Next, gather your equipment, including this central line removal kit. When we get to the room, we're going to explain the procedure to the patient, wash our hands, and then put on non-sterile gloves. Place the patient supine in a slight Trendelenburg position. Position the patient supine if the line is in the groin or the patient cannot tolerate Trendelenburg. For PICC lines, make sure to extend the arm at a 45 to 90 degree angle from the torso. Remove the dressing with a clean pair of non-sterile gloves. After removing the dressing, take off your gloves, perform hand hygiene, and put on your sterile gloves. Once you get your sterile gloves on, get the ChloraPrep applicator and clean the site. Use one hand to cover the insertion site with petroleum gauze and a folded sterile gauze over the site while removing the catheter, pulling it straight out while maintaining a gentle, constant traction, and regraft the catheter every few centimeters. Upon removal of the catheter, inspect the tip for integrity. For PICC lines, like you see in this video, compare with the documented insertion length. Discard the removed catheter in the biomedical waste container. There are times that there's an order to culture the tip of the catheter. If so, cut the distal 5 centimeters with sterile scissors and place it in a sterile container. Label and send to the lab for a culture analysis. During catheter removal, if there is resistance met and unable to remove the catheter, do not pull it. Apply an occlusive dressing to the site and the entire catheter. Notify the provider. If the site continues to ooze blood after applying pressure for 10 minutes or more, use Statio or surgical hemostat under the Vaseline gauze pressure dressing. If the patient has a central venous catheter in the jugular, subclavian, or femoral veins, have the patient either hold their breath during the catheter removal or time the catheter removal to coincide with the end of inspiration, beginning of expiration. Finally, document the procedure in Cerner and include the catheter length, how the patient tolerated, any complications, education provided, and that the pressure dressing was applied to the site. Thank you for watching the video. Now it's your turn to try. We're counting on you.